in SNFs, our residents there are some of the most complex patients in the country. They've got a lot of multiple, comorbidities. There's polypharmacy. There are often frequent changes of condition. And trying to coordinate care for those individuals in our standard health system often just doesn't work. It's pretty broken. You've got this PCP somewhere off-site. You've got specialists in different systems. You've got, ED visits, and no one hears about what happened. And all of a sudden, the resident shows up back at your doorstep sometimes. Um, you know, Nurses on the floor are trying to like communicate with these folks, and they're not just waiting hours, often days, for something that probably needs to be addressed clinically in a few hours in order to ensure that that person gets the care that they need and deserve, and ultimately the care that would allow them to live in that community safely. Um, I think I-SNP's intent is to collapse a lot of that. And it does matter who you partner with. But if you can find the right I-SNP partner that has one clinical team that's accountable to you and your residents, that is in the building multiple times a week, that is reachable in real time when they're not there, um, then you change the game. Like, responsiveness is everything when you're trying to coordinate care for these folks. And that difference between responding, I don't know, in 2 hours versus 2 days is like whether or not they need to go to the ED or not. And I think an I-SNP and the care team is fundamentally aligned to work with you to try to solve those communication challenges. And I'll give a plug here for Hucu. I don't get paid to tell you this, but like this was one of the reasons why we ended up using the Hucu platform in our model, because look, we've tried a lot of different ways to try to improve communication and coordination of services. And we still use a number of different things and have tried, but we've been using Hucu now for over 6 months. And it turns out it's a lot better than emails and faxes and text messages, often not HIPAA compliant text messages. And when you can get people on this type of a tool, you can make that type of real-time communication, close the loop and more effective. And, that results in a lot better care. I'm sure we'll get into that later, but when I think about coordination gaps and responsiveness, like, I think these are the things that come to mind. And it's really what separates kind of this broken system to like a really, I think, great experience for the resident, your staff, and the care team that are all trying ideally to work together towards a common goal.